Hi, my name is Jen Delaney, and I'm a therapist practicing brain spotting and parts work integrated with talk therapy in Boulder, Colorado. I see clients online and in person, and I thought it would be helpful for you if I made a video about how to find a good therapist or the right therapist for you. Towards the end of this video, I'll explain the differences between the different mental health fields. But anyway, I wanted to talk about some of the questions you might ask a therapist. So the first one might be, how many years have you been in practice? I've got to say that when I did therapy in my 20s, I saw an intern, and I have to say she was amazing. So sometimes you can find therapists in internship programs for a reduced cost, and they are attracted to the field for a reason. And they have studied, and they might need some practice and experience, but a lot of times these are great therapists. But you might want to find out how many years, describe your modalities, why you studied them, and how they could help me in particular. There are many modalities out there right now, and I know that clients can get confused by them. So other than talk therapy, there are body-centered modalities. They're called somatic, and they can be very helpful for accessing things in the subconscious mind, especially if you have had relationships that have been difficult or early childhood trauma, things that have created a perception of the world that isn't helpful to you. So anyway, those are the somatic modalities. There are more cognitive, like cognitive behavioral therapy, that aren't as long lasting if you have trauma, but can be helpful, just like life coaching could be helpful in a way. So what led you to become a therapist? Did you see a counselor? Of course, that's required in most programs, but it's nice to hear if your therapist has seen a therapist. How long does therapy take? I know that the answer for my clients would be it depends on the level of trauma and what comes up. And, could be anywhere from a few months to a couple of years. It's not like it used to be where you could expect to see a therapist for the rest of your life. There are modalities that move more quickly. I'm noticing I have a rainbow on my face. Okay. Anyway, so essentially, you want to trust your felt sense. Trust your gut. Once you've asked these questions, and maybe you've interviewed more than one person, several people, and that can sometimes stymie someone if they like all of them. So, look at their website, see if it resonates. You can get a recommendation from a friend, So, some of the differentiations between the fields can be really confusing. Psychologists, by and large, get PhDs. They have more of a medical model perspective, but I think they have a balanced perspective of wellness and medical. Most of them do not prescribe medicine, but with an advanced postdoctoral doctoral, thank you, training in clinical psychopharmacology, they can prescribe in some states. So mostly a psychiatrist can prescribe, and a psychiatrist or a psychiatric nurse, they are both trained medically, and so it can often be better to go to a psychiatric nurse just because they'll spend more time with you. They are as good as psychiatrists, I find, by and large. They just are able to spend a little more time and might be a little more reasonable, and you might be able to get into them sooner than a psychiatrist. So when would you go to a psychiatrist? It would be if you're dealing with schizophrenia or bipolar disorder, things that need to be medicated. And if you see a counselor, so I'll get into the rest of the fields in a moment, they feel that you could benefit from medication, they'll let you know. So sometimes medication is a great complement to therapy, even temporarily, if you're in crisis. But a lot of people don't require medication, but they might seek out a psychiatrist first because they don't know about the other fields. They get confused, so they're like, I'm just going to go to a psychiatrist, and they might start with medication when they don't really need it. So a psychoanalyst is going to be trained with a master's degree, but more Freudian lens. It's a specific type of therapy. So not all counselors or therapists are psychoanalysts. And then we have social work. So social work, marriage and family therapists, and licensed professional therapists are similar and all do similar things, but they are trained with maybe a slightly different lens. So a social worker is trained to consider the person in their environment. So more of a systems is how is that person being affected by their workplace, by their schooling place of schooling, or by their family. They're going to consider that holistic. They might be working for a clinic where they're recommending treatment facilities. They might work in hospitals, or for hospice. And they might also have a private practice, just like a marriage and family therapist or a licensed professional counselor. So, what are the differences between the other two? Marriage and family therapist comes from a family systems perspective. So, they'll see families, they'll see couples. They might see individuals as well, but they'll consider the individual in their system, in their family system. A licensed professional counselor, those three, the latter two and this one, all get 60 hours of in a master's program. So the licensed professional counselor, which is what I am, we consider the internal, emotional, cognitive, and development processes for an individual. We still keep an eye on, there's no way that to see an individual that we're not going to consider what relationship they're in or what family they're in, because it's really hard to make changes if there aren't changes in the family. So that individual has to build up the strength to draw boundaries and to advocate for themselves in maybe a system that isn't as healthy as they're becoming. So we do help individuals advocate for themselves as they get better. And so an LPC, or licensed professional counselor, also might work with families or couples, because I think by and large now those 3 degrees are considering the family and the individual holistically. Registered psychotherapist or an unlicensed psychotherapist really has no education. So if they're using that term, then might not be as helpful for you. A life coach has a certification in life coaching. So they might have done a 2,000 hour or 4,000 hour program that takes a year. They're not going to go as deeply into trauma or the subconscious mind, but they can also be great guides to some degree. So there it is. So I hope this has been helpful for you. Of course, you want to ask questions like, how much does your therapy cost? Because there's going to be kind of a standard depending on where you are in the U.S. as to what someone is charging. It might be based on their experience or their additional certifications, so that sort of thing. But usually there is a frequently asked questions section on a website that can give you a lot of insight. So I hope this has been helpful. Have a wonderful day. Take good care of yourself.